Hello, my name is Dr. Meenakshi Nayar. I'm a consultant in rehabilitation medicine, and today I've got the pleasure of interviewing Dr. Gui Tran, consultant rheumatologist from Harrogate. So, Dr. Tran, can you tell us a bit about gout? Because we're going to be talking about that today.
Yes, so gout is an inflammatory arthritis and it commonly affects postmenopausal women or males of any age.
Okay, and what are the symptoms that they present with?
The typical symptoms of an acute gout attack are it's sudden onset, so it usually occurs within 24 hours. It's extremely painful, so they can't weight bear, and it can affect their ankles, knees, or big toes or feet generally.
Okay, and you mentioned the types of people that get gout. Why do people get gout?
So about 60 to 70% of the cause of gout is genetic. So whatever they do, they can't modify their predisposition to get gout. About 30% is diet related, and that includes things such as red meat, alcohol, shellfish, or fructose in fizzy drinks.
Okay. So investigations, what would you do?
Well, the gold standard, if possible, is to aspirate the joint, and that's most commonly done in the knee. And then you send that off for microscopy, and you can see gout crystals, which are needle-shaped, and they say it's negatively birefringent on polarized light. You can also check for CRP, which is usually markedly raised because it's a very, very pro-inflammatory state gout is. Or you can check for uric acid as well.
Okay, and is uric acid useful in a gout flare?
Yes, it can be, but bear in mind that uric acid can be normal in people who are having an acute attack.
Okay, and what about the other way around if you find incidental high uric acid on someone's bloods?
So in the UK, we don't treat asymptomatic hyperuricemia normally.
Okay, and tell me about the role of x-rays.
So x-rays are important. They do have a role. They look for calcification, and they also look for gouty damage. And that would increase your swing the dial so that it makes you more likely to treat someone for gout.
Okay, and then you've taken an aspirate and there are crystals. What else could it be other than gout?
The differential for gout includes pseudo-gout, and they are rhomboid shaped when you look under the microscope. And they are positively birefringent on polarized light. But other diagnoses can include in people with a gouty attack, rheumatoid arthritis, or a seronegative inflammatory arthritis, such as psoriatic arthritis.
Okay, so talking about the management of gout, I'm guessing we start with conservative management first.
Yeah, that's correct. So conservative management includes avoiding exacerbating factors, such as dehydration, alcohol, or red meat. Some people like to try less intervention. So vitamin C has been shown to have a weak effect, but that's in higher doses, as has cherry juice.
Cherry juice?
Cherry juice extract, yeah.
Okay. And medication?
Medications, so for the acute attack, you can trial anti-inflammatories, or colchicine, or prednisolone, or a combination of the three, depending on the comorbidities of the patient. That usually helps settle the acute attack. And for the prednisolone, we either give intramuscular steroids, 120 milligrams methylprednisolone into the thigh, or oral steroids, prednisolone, 20 milligrams for a week should sort out the gout. And then for long-term treatment, we initially start with either allopurinol or febuxostat.
Okay. And then febuxostat, is that when someone doesn't tolerate the allopurinol that you try that?
Yes, usually that's why we start febuxostat rather than allopurinol.
Okay. And then anything we need to know about the levels of uric acid?
We normally aim for less than 360 micromoles per litre for uric acid. Some studies have said 300 is optimal, but what happens usually is that they respond well to less than 360, and it can take up to 2 years before they become gout-free.
Okay, and treatment is lifelong?
Treatment is definitely long-term.
And what do we need to know as rehabilitation medicine physicians about gout?
Okay, so the most important thing is to be able to diagnose it, to know when it's likely to be gout, for example, if it's an acute attack in their big toe, and also how you treat it in the initial stages, whether that be colchicine, anti-inflammatories or steroids.
Brilliant. Thank you for your time.
Thank you.